So the given specimen is bony pelvis. So let's start our topic. Bony pelvis is made up of 4 bones, 2 hip bones, sacrum and coccyx. It contains pelvic viscera, bladder, rectum, uterus in female. Pelvis supports the weights of body and transmit to the lower limb by sacrum, sacroiliac joint and hip bone. Now let's talk about joints of bony pelvis. There are 3 joints in bony pelvis: pubic symphysis, sacroiliac joint, sacrococcygeal joint. What are the ligaments of the bony pelvis? Interosseous sacroiliac ligament, dorsal sacroiliac ligament, ventral sacroiliac ligament, sacrotuberous ligament, sacrospinous ligament. What are the parts of bony pelvis? Bony pelvis is divided into 2 parts by plane of pelvic inlet or circular curved line, also known as superior aperture of pelvis or pelvic brim. Part above this plane is called greater pelvis or false pelvis. Part below this plane is lesser pelvis or true pelvis. Regions of true pelvis: pelvic inlet, pelvic cavity, pelvic outlet. Now let's talk about boundaries of pelvic inlet. Posteriorly, sacral promontory and anterior margin of ala of sacrum. Laterally, arcuate line and pectineal line. Arcuate line consists of iliac part and ischium part. In front, upper margin of pubic symphysis and pubic crest. Boundaries of pelvic cavity. Anteriorly, pelvic surface of bodies of pubic bone, pubic rami and pubic symphysis. Posteriorly, pelvic surface of sacrum and coccyx. Laterally, pelvic surface of ilium, ischium below the arcuate line. Boundaries of pelvic outlet. Anteriorly, lower margin of pubic symphysis. Anterolaterally, conjoint ischiopubic ramus. Laterally, ischial tuberosity. Posterolaterally, sacrotuberous ligament. Posteriorly, tip of coccyx. Obturator foramen. Obturator foramen is covered by obturator membrane. Pelvic cavity is J-shaped. It is directed downward and backward and then downward and forward. Now let's talk about anatomical position of bony pelvis. Anterior superior iliac spine and pubic tubercles lies in same coronal plane. Pelvic surface of pubis backward and upward. Anterior surface of pubic symphysis downward and forward. Pelvic inlet forward and upward. Sacral canal almost upward. Easy method to put bony pelvis in anatomical position is pelvic outlet makes an 15-degree angle with horizontal. Pelvic inlet makes an angle 50 or 60 degree with horizontal plane. Now this is the anatomical position of bony pelvis. Now let's talk about measurements of bony pelvis. Diameters of pelvic inlet. Antero-posteriorly. Anatomical conjugate. Distance between midpoint of sacral promontory to upper margin of pubic symphysis. True conjugate. Distance between midpoint of sacral promontory to midpoint of pubic symphysis. Diagonal conjugate. Diameter between midpoint of sacral promontory to lower margin of pubic symphysis. Oblique diameter. Oblique diameter extends from sacroiliac joint to iliopectineal eminence. Transverse diameter. Diameters of pelvic outlet. Antero-posteriorly. Tip of coccyx to lower margin of pubic symphysis. Transverse diameter between two ischial tuberosity. Oblique diameter. Distance between junction of ischiopubic ramus of one side to midpoint of sacrotuberous ligament. Diameters of pelvic cavity. Antero-posteriorly, midpoint of third sacral vertebra to middle of pubic symphysis. Oblique diameter. Lower end of sacroiliac joint of one side to middle of obturator membrane. Transverse diameter. Subpubic angle or pubic arch. It is formed by conjoint ischiopubic rami and arcuate ligament, which is present at lower margin of pubis symphysis. Subpubic angle is less than 90 in case of male and more than 90 in case of female. Now let's talk about pelvic planes. Planes of greatest dimension. Imaginary plane passing through middle of pubic symphysis and junction of S2 and S3 vertebra. Plane of least pelvic dimension. Imaginary plane passing through lower margin of pubic symphysis to tip of sacrum. Transverse plane of least pelvic dimension. Imaginary plane passing through ischial spine. Now let's discuss the differences between male and female pelvis. This is male pelvis superior view. This is female pelvis superior view. This is male pelvis inferior view. This is female pelvis inferior view. Pelvic inlet is heart shaped in case of male. Pelvic inlet is oval shaped in case of female. Pelvic outlet is comparatively smaller in case of male, whereas it is comparatively larger in case of female. Sacrum is longer and narrower in case of male, whereas sacrum is shorter and wider in case of female. Ischial tuberosity. Ischial tuberosity is sharper, longer and pointed to body midline, whereas in case of female Ischial tuberosity is pointed outward and shorter. Now let's see the differences between sciatic knots in case of male and female. The male sciatic knot tends to be narrower and U-shaped. The female sciatic knot is wider and V-shaped. Whereas in some individuals, the sciatic knots may be intermediate, that is, it is neither U-shaped or V-shaped. So it is difficult to assign as male or female. As you see in this diagram, the shape of pelvic inlet in case of male is heart shaped. In case of female, it is oval shaped. Talking about the pelvic cavity appears to be long and tapered. It seems to be a part of long segment of a short cone. Whereas in case of female, pelvic cavity is short with almost parallel sides. And it seems to be a part of short segment of a long cone. This is subpubic angle or pubic arch. It is less than 90 degree in case of male, whereas it is greater than 90 in case of female. Now let's summarize the differences between male and female pelvis. General structure: it is heavy and thick in case of male, light and thin in case of female. Articular surfaces: it is large in case of male, small in case of female. Muscle attachments: it is well marked in case of male and indistinct in case of female. False pelvis: it is deep in case of male and shallow in case of female. Pelvic inlet: it is heart shaped in case of male, it is oval shaped in case of female. Pelvic canal or cavity: it is long and tapered in case of male and it is short with almost parallel sides in case of female. Pelvic outlet: it is comparatively small in case of male, whereas it is comparatively large in case of female. First piece of sacrum: superior surface of body occupies nearly half the width of base of sacrum. Superior surface of body occupies nearly half the width of sacrum, whereas in case of female, superior surface of body occupies about 1/3 of the width of the base of sacrum. Sacrum: it is long and narrow with a smooth forward concavity. Sacrum in case of male is long but narrow, whereas in case of female it is short, wide, flat, curving forward in lower part. It is short and wider in case of female. Sacroiliac articular facet: in case of male it extends down up to lower border of third piece of sacrum. Sacroiliac articular facet: it extends down up to the lower border of third piece of sacrum, whereas in case of female it extends down only to upper border of third piece of sacrum. Subpubic angle: it is less than 90 degree in case of male, whereas in female it is 90 or more. Inferior pubic ramus: inferior pubic ramus in case of male, it presents as a strong everted surface for the attachment of the crus of penis, whereas in case of female this marking is not present. Acidapulum: it is large in case of male, whereas it is small in case of female. Ischial tuberosity: it is inturned or rounded in case of male, whereas it is everted in case of female. Obturator foramen: it is larger and oval in case of male, whereas it is smaller and triangular in case of female. On the basis of pelvic beam index is the ratio of anterior posterior diameter by widest transverse diameter multiplied by 100. Pelvis is morphologically divided into 4 types, that is mesothelic pelvis, it is most common form; brachypelvic pelvis, platypelvic pelvis, dolicopelvic pelvis. In mesothelic pelvis, transverse diameter of pelvic inlet is slightly more than anterior posterior diameter. In brachypelvic pelvis, anterior posterior diameter is slightly more than transverse diameter. In platypelvic pelvis, transverse diameter is much greater than anterior posterior diameter. In dolicopelvic pelvis, anterior posterior diameter is much more than transverse diameter. Let's talk about types of female pelvis and their features. Gynecoid type, it is normal type. It corresponds to mesothelic pelvis. Android type, it is male type. It corresponds to brachypelvic pelvis. Platyploid type or flat pelvis. It corresponds to platypelvic pelvis. Anthropoid type, that is it is app type. It corresponds to dolicopelvic pelvis. In gynecoid type, inlet is transversely oval, that is transverse diameter is more than anterior posterior diameter. More space present in the pelvic cavity. It is suitable for easy passage of baby during delivery. In android or male type, inlet is heart shaped, that is anterior posterior diameter is more than transverse diameter. Pelvic cavity is funnel shaped. Outlet reduced in all diameters. May result in obstructed labor. Platyploid or flat pelvis. Transverse diameter is much greater than anterior posterior diameter. Inlet is anterior posteriorly compressed. Poses difficulty in delivery. Anthropoid type. Anterior posterior diameter is much greater than transverse diameter. So inlet is compressed from side to side. Poses difficulty in smooth delivery.